would say that the courses here are almost invaluable. I came into the profession with such a foundational knowledge of exactly what it is that I needed to do. And one of the great things about the courses here is that you have so many opportunities to try things hands-on besides just textbook learning. There are volunteer experiences, there's clinicals, there are 2 whole internships that you go through. And so I think that makes you more confident of an individual. It pushes you out of your comfort zone a lot quicker maybe than you'd like to. And now I'm a regional director of recreation services, so I oversee multiple buildings in other departments. I oversee other directors who are 2 times my senior, but I feel confident in what I have to offer and the information that I need to share with other people because of the experiences and the exposure that I had as a Temple University student that made me just more confident in who I am today. I truly felt like when I sat and was answering these questions, it was second nature. This was information that we talked about for 4 years in every course. You sat down at this exam and you just kind of problem solved through like, okay, well, if this was my patient with this diagnosis or this level of functioning, how would I treat them? This is something that I've been doing for 4 years. And so I definitely felt confident coming out of the NCTR exam and sitting in front of these questions, knowing that the program really had set me up for complete success to do well on this exam. I don't think there was one course that I took in the rec therapy program here at Temple that didn't require some sort of research. There was always at least one assignment along the way where you had to do either like a literature search or a literature review, a systematic review, whatever you want to call it. So we were always exposed to how to do research, how to search for the information that we needed to know. And that's pivotal for rec therapists because not only do we need evidence-based practice to know what interventions to do with different diagnoses or different, functional levels or whatever it might be. But we as rec therapists are constantly validating what we do and proving to other people our worth as a rec therapist and why we should be a part of the interdisciplinary team. And so knowing how to do research is important in order to back up all of the claims that we have. And so I truly believe that doing so much research and having so much practice with it as a Temple University student, that we were always ahead of the curve. I have had more students probably than I can count from Temple University, between interns, between students doing their clinical experiences, and even students just doing some volunteer hours here and there. And the one thing about Temple students coming in under me is that I already know what to expect from them, in the sense that I know what they've been set up and how they've been prepared for this experience in the first place. I feel like after a brief orientation of getting to know the facility and some of our residents, these students are ready to go. They are ready to hit the ground running. They know what they're doing. They have plenty of exposure. And I truly feel like Temple sets them up for the utmost of success, because right from the get-go, I can take these students and really push them out of their comfort zone. And I feel like Temple students coming into their internship are ready to be pushed out of their comfort zone almost instantly, because they have the foundational knowledge and all the experience coming into it, that they're almost ready to be an entry-level professional sometimes when they come in at the internship level, because of all of the experience and exposure that they had.